Hospital-acquired infections, or HAIs, are infections that patients get while receiving treatment in a healthcare setting. These infections are a serious concern worldwide. They can lead to complications, prolonged hospital stays, increased healthcare costs, and even death. Understanding HAIs is crucial for both healthcare providers and the public. HAIs typically appear 48 hours or more after hospital admission. They can also develop within 30 days of discharge. These infections can affect various parts of the body. Common sites of HAIs include the bloodstream, urinary tract, surgical sites, and lungs. According to the World Health Organization, 7 to 10% of hospitalized patients acquire HAIs. The rates are significantly higher in developing countries due to various factors. These factors may include limited resources, overcrowding, and challenges in implementing infection control measures. HAIs pose a significant threat to patient safety and global health. Addressing this issue requires a multifaceted approach. This includes understanding the types of HAIs, risk factors, transmission routes, and effective prevention strategies. Several types of infections are commonly acquired in hospitals. Some of the most prevalent HAIs include catheter-associated urinary tract infections, central line-associated bloodstream infections, ventilator-associated pneumonia, surgical site infections, and Clostridioides difficile infection, commonly known as C. diff. Many factors can increase a patient's risk of developing an HAI. These risk factors can be categorized as patient-related and healthcare-related. Patient-related risk factors include age, underlying health conditions, weakened immune system, and length of hospital stay. Healthcare-related risk factors include use of invasive medical devices like catheters and ventilators, surgical procedures, improper hand hygiene among healthcare workers, and inadequate environmental cleaning. HAIs can be transmitted through various routes. Direct contact, which involves touching an infected patient or their surroundings. Indirect contact, which involves touching contaminated surfaces or equipment. Droplet transmission, which means contact with respiratory droplets from an infected person. And airborne transmission, which involves inhaling tiny infectious particles in the air. Preventing HAIs requires a comprehensive approach involving healthcare workers, patients, and visitors. Key prevention and control measures include hand hygiene, which means frequent and thorough hand washing with soap and water, or using alcohol-based hand sanitizers. Personal protective equipment like using gloves, gowns, masks, and eye protection when appropriate. Environmental cleaning, which involves regularly disinfecting surfaces and equipment. Antimicrobial stewardship, which means using antibiotics appropriately and only when necessary. Isolation precautions, which involves separating infected patients to prevent the spread of infection. And surveillance, which means tracking and monitoring HAI rates to identify trends and implement targeted interventions. Despite efforts to prevent HAIs, challenges remain, including antimicrobial resistance, which is the emergence of drug-resistant bacteria that makes treating HAIs more difficult. Resource constraints, especially in developing countries, which can hinder infection control efforts. Healthcare worker compliance, which means ensuring consistent adherence to infection control practices, can be challenging. And emerging infectious diseases, which means new and unknown pathogens can pose unexpected threats. Addressing these challenges requires ongoing research, innovation, and collaboration. Future directions include developing new and improved infection control technologies and strategies, strengthening surveillance systems to detect and respond to outbreaks, promoting education and awareness among healthcare workers and the public, and investing in research to combat antimicrobial resistance and develop novel therapies. Preventing HAIs is an ongoing battle that demands a multifaceted approach. By understanding the causes, modes of transmission, and effective prevention strategies, we can create safer healthcare environments for everyone.